Namaste. Welcome to part 2 of the different constellations of anxiety in the therapy spectrum. So, we were somewhere in the discussion where we talked about the spiritual aspect, how rationally and intellectually we talk about the concept of death with acceptance, and whereas in the Western concept of psychoanalysis or the field of psychology itself, we talk about the pain of it and the pathology of aspect of it. So, what is the difference between these two?
First difference, as we said, I'll just repeat it and then go into the different treatments or the different engagements that both of them have with death and pain. Psychoanalysis believes that the anxiety of death and anxiety of pain are inbuilt, instinctual. They are hardwired into us. And the goal of therapy can only be to minimize it, make it conscious, understand it profoundly, overcome it to substantial degree, and what is left, with a profound acceptance, manage it. But it doesn't talk about erasing it from its roots. Spirituality that way is more liberal, more positive, one can even say more adventurous.
To an extent of transcended it completely.
Yeah, it talks about overcoming possibility of completely overcoming the anxiety of death and anxiety of pain and being completely free from it. So the limits of human potential are different in psychoanalysis and spirituality. Spirituality is liberal, psychoanalysis is conservative when it comes to the limits of human potential. Spirituality presents before us enlightened persons who have completely overcome the anxiety of death and pain. So all the great revered people in the area of spirituality essentially are the ones who have overcome the anxiety of death and pain. And this, we are told, happens only when you are free from desire. That when you are free from desire, you are free from the attachment to pleasure and aversion to pain. And it is only then that you can actually be free from the anxiety of death and anxiety of pain. In fact, in spirituality, that is one of the goal states. Not only it is accepted to be possible, actually it's the goal state, which is very different from the goal state of psychoanalysis. So minimizing versus complete freedom and mastery. The goals are different. In psychoanalysis, since we don't even accept that it's possible to come out of it completely, nobody has even tried to create tools to explore if it's possible. But in spirituality, a lot of action has taken place. And this brings us to a very important point of contemplation on death and contemplation on pain. It's a very important point.
Right.
Freud contemplated on death and came up with the idea of death instinct. But that went slightly away from death anxiety because it went into aspects of inertia, it went into aspects of degradation of the human system, it went into aspects of aggression and destruction, it went into aspects of masochism. It slightly went away from the fundamental point of death anxiety.
So, does that mean that he's talking about the translation of this anxiety into these channels?
In his conceptualization of death instinct, it is slightly separate from death anxiety. because as a result of death instinct, death anxiety will come up. When the death instinct comes on ourselves, death anxiety comes up. And two things happen. Say, our death instinct partly will turn into aggression, partly will be responsible for masochism, partly for the love of inertia, partly for the repetition, partly for the three destructive addictions we have: inertia, indulgence, and indolence. Or rather, I should say inertia, indolence, and indulgence. So this will be the manifestations of death instinct. But when one of the manifestation of death instincts would be, it comes on ourself. Our death instinct comes on ourself. And that is terrifying for the will to survive. And therefore, there is death anxiety as the death instinct comes on ourselves. And therefore, two things happen. One, partly we feel the death anxiety, and partly, or rather largely, there is deflection of the death instinct from coming onto us, onto some other object in the form of aggression. So the death wish or the destructive wish towards an object, maybe because the object has frustrated us, or maybe because it's a deflection of our death instinct.
Basically, projection of.
Yeah, it's a deflection of our death instinct. Right? In fact, Klein starts with this deflection as one of the major sources of attack on the bad breast.
Yes. Oh.
That one of the sources of attack on the bad breast is also the deflection of the death instinct. Not only the aggression resulting from frustration of non-availability of the good breast, but part of it also is deflection of the death instinct. And many Freudians and many Kleinians are very uncomfortable with the idea of the death instinct. They are more comfortable with the idea of aggression as rooted, hardwired in human nature without a reference to death instinct.
Is it?
But Freud and Klein both were clear about the idea of the death instinct, and both were very particular in insisting that this actually is there. Right? That either aggression is subservient to death instinct, or death instinct in certain manifestations turns into aggression. Either of these two is at work, but there is a death instinct distinct from aggression and strongly associated with aggression. So both of them were very clear in this metapsychological conceptualization, which many people don't like. They like everything about Freud and Klein except the death instinct. So they conceptualize like aggression is inbuilt in human nature, out of survival. Right? So survival and pleasure are two fundamental motivations, and survival leads to aggression and pleasure leads to libido. This is very, very acceptable to many. They find it very mystical, this whole idea of death instinct. It's difficult to discover, but I think it's valuable in its own realm. Some other day we will get into the discussion on death instinct. Today, coming back to death anxiety. The contemplation in psychoanalysis, as I said, was largely done by, not largely done, but Freud and Klein contemplated death instinct rather than death anxiety. Right? And manifestations of pain anxiety rather than generic pain anxiety. What Freud did not contemplate so deeply as Klein did was the idea of attack and loss. Because in the Kleinian scheme of things, attack and loss are fundamental. Right? Attack and loss and internalization of a good object and inability to internalize a good object, these are fundamental, like envy, like the split open, and like greed. Right? These are fundamental aspects of Kleinian pathogenesis, and healing therapy. So in psychoanalysis, attack and loss has been conceptualized first widely by Klein, less by Freud, but he did conceptualize, but not as intensely as and as pervasively as Klein. After that, the followers of Klein and others have conceptualized this, but not everyone. Everyone doesn't put the ideas of attack and loss at the center, but they are very powerful ideas and very pervasive ideas. We find them. If we have it in our mind, we find them everywhere. I mean, a large space of pathology, not everywhere, but large space of pathology. In philosophy, death was contemplated and the death anxiety was contemplated slightly differently. Existential philosophers, they contemplated deeply upon the idea of death and the idea of death anxiety and idea of anxiety separated from death. Heidegger can be mentioned here. It is said he used to keep a skull on his table to remind him of the inevitability of death. Okay. Because usually we use the defense of denial to overcome the death anxiety. And Heidegger wanted to, in some way, if not get over, at least dilute that defense of denial.
So was it for him or was it for the clients?
No, it was for him. For him, it was the idea was that if death is inevitable, what does the acceptance of this inevitable bring to me? And to most people, it would bring only pain and anxiety. That's the reason why most people find it more prudent and more productive to use the defense of denial, right, and live with the illusion of omnipotence, which is far more pleasant and far more productive. For Heidegger, the idea was two things. One, what does this inevitability of death bring to me? And second, if death is certain, how do I passionately live life as I move towards death?
Beautiful.
And the third was, so it creates a kind of passionate movement given its finitude. That if life is finite, why not to live it with intensity and passion and authenticity? And the third was that death is not an experience in life because we don't exist to actually experience death. And therefore, it's a strange thing that while it's ours, we don't experience it. In fact, our ceasing to experience everything is what is defined as death. And yet it is our death. And he used to say that my death is my own most. That life can betray, but death will not betray. It is our own most. So this was his contemplation on death anxiety. In the Tibetan Buddhism, this contemplation about death and experiencing near-death states is a preparation for death. They spend quite some time in preparing for death and overcoming death anxiety. Sri Aurobindo has contemplated a lot, and not only contemplated, but did sadhana of these aspects. And he has a very different take on pain. And this brings us to the spiritual approach to it, that once you look at reincarnation, you accept reincarnation, and you go deep into the death anxiety and the pain anxiety, can you come out on the other side? Or is there no other side? So Indian spirituality, especially Hindu spirituality, tells us that there is another side. If you go deep into it, you come out on the other side, free from this death anxiety and pain anxiety. And Sri Aurobindo tells us that he came to a state where pain was seen as concentrated pleasure. A pleasure so concentrated that we are unable to bear it, and therefore we feel it as pain. And if one develops enough, one can actually convert these painful sensations into a very intense pleasurable sensations. And that is separate from masochism. We are not dealing with masochism here. We are dealing with a slightly different realm of human experience and human transformation. So this is how the East and the West, philosophically, spiritually, psychoanalytically, have looked at it quite differently. The ideas of death anxiety and pain anxiety. Loss and attack. Yeah, loss and attack essentially are seen as human weaknesses in spirituality. And it's one of the goals to overcome the fear of loss and attack. And the idea always is to overcome and master attachment. Sorry, you were saying something.
No, I was just admiring the collection of all the philosophies you just mentioned. So very profound indeed. But
Thanks.
when we come to the application part of it, how can we use the 4 fundamental fear structure into the therapy?
Right. So that is where the core comes. Why all this discussion? Obviously, all this discussion because it can help us to do therapy better. And the way to use this discussion is this. Client will tell us the story of his life events. And in that story of the life events, we will most of the times, not always, but most of the times find some anxiety related to loss or attack. Right? Like the client tells us, I like this man, but he is talking to that girl. And that disturbs me very badly. When I see this man talking to that girl, it just spoils my day. So we investigate further and we say, what do you feel when that happens? And the person says, I feel very angry, very irritated. I also feel sad at times. At times, I just feel very anxious. So there is a collection of mixed feelings coming up. And we can tell the client, do you feel anxiety of losing this person? And the client would say yes. And we say, are these feelings of anxiety, pain, and anger all activated because of the potential loss of the person? And the client would say yes. That because of the potential loss, anger, irritation, anxiety, and sadness all are triggered. And all of them together make me disturbed and spoil my day. Similarly, a client can say that I am a businessman. Person X owes me money, but I find it difficult. I hesitate to ask for money. And we can say, what is the fear like? Do you feel that he will feel bad about it? It will hurt him? The client says no. Then we say, maybe it is that you are afraid he will attack you if you ask for something. And the most probably the client will initially say no, and after a few sessions say yes. That
it can be fear of losing the contact also.
Yeah, there can be a loss. Yeah, it can be both. It can be loss fear, it can be attack fear, it can be both. But in many cases, it's the fear of attack.
Mm.
And it will be confirmed by behavior in other situations also. Like
Okay.
you buy something, you come home and you are not satisfied, and the shop has assured you that you can return if you want, but still you don't find it comfortable to return. You would throw it in the dustbin and incur the loss rather than go to return.
So is it fear of attack?
Often it
Like
is.
on the surface, it could be to do with the self-image or underconfident self. This is what we usually translate these
All
things.
of this can be, and it can also be accompanied by a fear of attack.
In the deepest of the unconscious, it would be fear of attack,
Yeah,
which
it
would
can.
have layers of all this.
Yeah, it can go along with everything that you said. Or a avoidant person
Or it
is,
can be displeasing the parental figure,
yeah,
and that's the fear of attack.
yeah, displeasing the parental figure. Yes, there is but what is the anxiety related to it? That the parental figure will attack.
Attack, exactly. Thus interpreting into fear of attack.
Yeah. Say a employee does not want to talk to his boss, keeps a distance, although he is working very well, but he does not want to make a good relationship with his boss on a personal level because of the fear of attack.
Fear of attack.
A student,
There it is quite evident.
yeah, a student is terrified in the class because of the fear of attack of the teacher. So the fear of authority figures is deeply the fear of attack. The fear of not being able to start a conversation with a stranger can be a fear of attack. Right? A schizoid personality disposition, not getting close to anybody, can be a fear of attack. Not standing up for one's rights can be a fear of attack. Trying to please an authority figure can be because of the fear of attack. So the fear of attack would be widespread in the life of the person as he narrates his events. Similarly, the fear of loss can be widespread. So from his life events, when we start to connect the fear of loss and fear of attack, and we do it 2-3 times, the client gets it that yes, there is a fear of loss and fear of attack. It may not come directly, it may come after a few sessions, but it will come. So the first thing is to start with client's narrations and bring in the element of fear of attack and fear of loss, because it's obvious in his narration. And because of these two fears, he is suffering. He's paying a cost for it. And from there, we go deeper as to why you fear loss so much. Attack to pain is very simple, that we can ask him that you fear an attack because it will hurt you. It will cause pain to you. So fear of attack, generically being fear of pain, is very easy to discuss. But fear of loss requires some discussion. That if you lose somebody and there is a vacuum in your life, what happens to you? What happens to you when you are lonely? Why are you so terrified of vacuum, of having nobody around you? So there we realize that when we go deeper, again, it may require a few sessions. It may not be digested in the first discussion, but we'll come to this, that the fear of loss will be related to the fear of pain of loss of attachment, and also the anxiety of death. So once it is there, then we are dealing with generically the anxiety of death and anxiety of pain. If we don't want to go deep enough, if we believe that just by working at the level of loss and attack things can be healed, we can heal it right there. We don't have to reduce it further down to its elementals. But if need be, if working at the level of loss and attack is not giving us results, we may have to go deeper to the generics of death and pain. And there the question will
It
be,
is the ego strength,
yeah,
provided the ego strength allows, because it can be again anxiety evoking the moment you get into the deeper aspect purely, which is the death anxiety.
right. But you will be surprised, most people feel good when you bring in these elements. When you bring in these elements by saying that all human beings generically have the anxiety of death and anxiety of pain is generic to all human beings. It comes as a relief to the person.
Yes.
Yeah. That one, it has been brought into discussion, something which is deep and obvious but was not brought into discussion as yet. Something he easily understands, something that connects him to the larger community because he's not alone, everyone is with him. The difference is of degree. And then the question comes what to do about it. One of the reasons why people don't go from loss and attack to death and pain is because once you go to the level of death and pain, the question comes what to do now. Yes, the client has anxiety of death and anxiety of pain. Now what to do? How to address this anxiety of death and anxiety of pain? And there the difficulty is of psychoanalytic framework and psychoanalytic tools. One of the good ways to deal with it is to bring in the element of courage, reincarnation, and philosophy. Unfortunately, neither of the three is a popular tool in psychoanalysis. But if you bring these three tools in, it helps to really help the client in doing something about the fear of death and fear of pain beyond reality acceptance. So you just be there, you contemplate on life and death, you contemplate on pain and pleasure. So the first phase then becomes of contemplation, analysis, cognitive part. Then you get into the philosophy of it. Then you get into the feelings related to it, the affect. And then how defenses work. And then the spiritual part, if you can, that in a spiritual sense, how do you engage with it and how do you do the journey to the other side if there is an other side, or at least substantial healing, far more than psychoanalysis would traditionally hope for. So this is how we can bring that part in, and this creates a quadrant of 4 fears: loss, attack, death, pain. And if these 4 anxieties are understood and dealt with to whatever extent they can be dealt with, I think it would be a great relief and a great healing and development for the person. Because these keep operating at higher or lower intensities across our lives in a variety of situations. We don't even know that they are operating. And many of the actions we do are an attempt to address them without our knowing it, and we pay a cost for doing so. So it's very important to appreciate the importance of these 4 anxieties, 4 fundamental anxieties, bring it into discussion, work on it using holistic healing tools if necessary, including spirituality, and help the client be as free of it, as masterful of it as possible. And then, of course, once you leave it, the defenses will take over whatever the rest of it is left.
Yet another insightful discussion. Hope our viewers have found it interesting too. See you all again. Namaste.
Namaste.